This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. In this episode, I welcome on my dear colleague, Dr. Jill Crista. Before we get started with the introduction, I want to let you know that we've dedicated this particular episode in honor of Dr. Crista. We've dedicated it to the Neuroimmune Foundation. You can find their work at neuroimmune.org. This is an organization that Dr. Crista feels very strongly for, and we will make a contribution in honor of this episode once we've reached 100 plays. Please feel free to make your own donation by going to their website, neuroimmune.org. Now for today's episode. Dr. Crista is a pioneering naturopathic doctor, clinical educator, and best-selling author. She is also a creative innovator. She focuses on conditions that cause injury to the brain and nervous system, including mold, Lyme disease, and concussion, and is an expert in the topic we are discussing today, PANS and PANDAS. She recently came out with a book called A Light in the Dark for Pandas and Pans. You can get this book on Amazon and other retailers, and this is an amazing guide for people who are dealing with PANS and PANDAS, such as parents and their families. It's a collective resource that will help people get focused on getting better with the right information in their hands. We go into many aspects of PANS and PANDAS. PANS stands for Pediatric, Acute, Onset, Neuropsychiatric Syndromes, and PANDAS stands for Pediatric, Autoimmune, Neuropsychiatric Disorders associated with Streptococcal infections. These are related disorders, and they both cause neuroinflammation in the brain and have some severe symptoms such as OCD and anxiety. They are related to many other chronic infections and chronic environmental pathogens and environmental toxicants. And Dr. Jill does an amazing job in today's episode talking about what is the underlying cause of PANS and PANDAS and understanding what's happening in the brain and what's leading to certain behaviors and changes in personality and other body symptoms that the patients are dealing with. This is an all-consuming condition. Parents are often at their wits' end as to what to do and how to help their child. And there is a lot of empowerment in learning in the root cause of these disorders and understanding the different treatment modalities and treatment approaches that are available. In this episode, we go into those things in great detail as far as the root cause, things to consider to help your child, and also provide a framework of understanding what treatments are likely to help. So without further ado, I welcome you to this week's episode of the One Thing Podcast. Dr. Jill, welcome back to the One Thing Podcast. I'm so happy to be here with you again.
Thank you so much for having me. It's such a treat to talk with you again.
Thank you. I'd love to catch up on the last couple years of your life. I know there's been a lot happening since your last podcast with us. So maybe you could give us an update.
Sure. I published another book. So yeah. That's kind of what I did. I went into a hole. I spent a summer off, teaching and being on social media, those sorts of things, so I could get my book fully researched and written, and then pared down quite a bit to the most important things and the most simple language that I could explain things. So that's what I've been up to, that. And I started a membership because I haven't been able to take new patients in quite some time. The families that I start with, they divide. That's just kind of the way it goes, And so I tried to figure out something where people could come and at least get support and get my perspective if they're interested in that. So I've been also working with the amazing members in my membership it's just this beautiful, supportive group of people. And we do things in more of like a one-to-many, so I'm talking to the whole group. And what's so great about group learning is that when someone asks a question, you think, I didn't even think to ask that question. You only know the questions that you think to ask. And so it's really expanded everybody's knowledge, and including mine, So that's what I've been up to.
That's very nice.
Yeah.
Very nice. And so I know that most of your previous work leading up to that was addressing mold and Lyme, and that was kind of like a core of your focus. Can you share with us a little bit about your journey into the world of PANS and PANDAS, and just kind of, I know a little bit about it, and of course, like you talk about it in your new book quite a bit, but I'd love for us to kind of hear sort of how that took hold in your life.
Well, I gave birth to them, 2 kids with PANS. So that's the first thing, is the being in the trenches and not really understanding what's going on. Back then, that would be 20 years ago, we didn't even have diagnoses, and so it was just living it, And so mold is sort of the center of this wheel, and there are many spokes that go out from that. So that kind of shapes the specialties that I enjoy working with, is the complex chronic conditions. That's neuroinflammation and stealth infections and toxicity is kind of the how those all come together. And mold is so often at the center of that wheel. So it's mold and then Lyme, chronic Lyme, mold and dementia, mold and Alzheimer's, mold and MS, mold and cancer. Another one of my, my preceptorship was at the Cancer Treatment Centers of America. So all of these things that just kind of built my skill sets. And then finding myself in Lyme country in Wisconsin. That's a really good way to realize, I better know something about Lyme disease. So then mold and PANDAS PANS, I got to that kind of a circuitous route, which was working with Lyme patients. First I thought everybody had they did have heavy metal toxicity, but you clean that up and a lot of people get better, and then some people didn't. And I'm like, well, why? What's going on with these people? Oh, they have Lyme disease. Okay, go get trained at ILADS, treat their Lyme. A lot of people got better. Still, there's these persistent people who didn't, and then realize that's a mold problem. And treat the mold. A lot of people get better, but why is mold causing these other things? You start to see the pattern of like, oh my gosh, I think my MS patients who had Lyme also have mold. And oh my goodness, I think, so you start making the connections. And it wasn't until my kids were 10 or 11, I was at a Lyme conference listening to the Dr. Charles Ray Jones, who we ended up treating with. I think they must have been younger than that, probably 9. I don't even remember. But I'm sitting at the conference, and it was that moment of, oh my goodness, I think my kids have gestational Lyme. And actually, I thought they just had Lyme. And then we went to go see him, and he turns to me and he says, how's your Lyme doing? And I, how are you doing on your treatment? And I was like, what? What? I don't have Lyme disease. I have fibromyalgia, even though I was, going through the training, I learned a lot more. And it was just that thing of like, he said right at the very first thing, they do have Lyme, but they have PANS also. I have twins. That's why I refer to them as they all the time. So they got it from mom, got this Lyme disease thing, got mold in utero, and developed this autoimmune condition at a very young age. And that's how I start my book, is that this is more than an infection problem. This is much more than a strep problem. This is an immune depletion setting the stage for toxins to not be able to be cleared from the body so that when the infection hits, the immune system is not up for taking it on and it can become autoimmune. Yeah. Long story.
And yeah, it's, and I want to get into that a little bit more. I think it's probably a good time to, since we both have been medical parents, I think we both have like appreciation for just that life of being a medical parent, and maybe like tuning into a podcast like this because you're just either in a sense of you're inspired to learn more, or you're feeling desperate, or you're feeling like what are we missing? It's such a heroic path, but also such a challenging path. And I just think it'd be nice just to kind of set a container for our listeners about all the information, and how to digest it. Do you have any insight, like, as to, how to ground yourself so that it doesn't cause, more stress and anxiety when you're seeking health information?
Yeah, just remember it's just that. It's information. And then your discernment is the real medicine. What can come into the field and what can't. And being really mindful of the frequencies that you expose yourself to as that medical parent, that you might be more drawn to things that are more dramatic just because you're living in drama. So taking that moment to say, okay, wait a minute. I'm going to just take this in as information. And then I'm going to check in with my heart and my kid, because your kid better than anybody, better than any. You are the greatest authority on your kid. And the child is the greatest authority on themselves. So sometimes you can be in the state of a parent and be really freaked out from a symptom. Like we have kids who are afraid to let their poop go, and so they'll put it in their pillowcases. Like this is how scary it can feel as a parent, because you see that and you think that is insane behavior. No, it's not. It's information. What they're telling you is, I need my microbiome. I'm low on probiotics. I'm low on commensal species, so I don't even want to let this go. So when we can just stop from the fear moment of, living in the chaos part, and take a deep breath and realize, okay, I'm my greatest authority on my kid. My kid's the greatest authority on them. And now I'm just getting this information. What of all of this fits right now? Maybe you put a pin in some of it because it feels right, but it's maybe not the right time, or it's too overwhelming. Put lots of pins in things. And that's the nice thing about a podcast, is you can listen to them over and over and over again. So I think just keeping that, trusting yourself as your greatest authority, and the rest of it is just information. So you get to choose. Yeah. What do you think? I'm curious how you handled that as a medical.
Yeah, I mean, that was, I think that was it really resonated with me. And I'll tell you why, because I think if you approach something from a point of curiosity versus I have to know this, or this is what I'm missing, or this is the answer, and you pin your future on information, or you pin, then it can be a slippery slope. So, I mean, for me, it's curiosity, and I think that's kind of what you're talking about, is like, it's information, reflect on it, learn, stay objective, see if it applies to you. And at the end of the day, you have to digest it, and it has to assimilate, and it has to be applicable, because every little thing that comes your way, and ideas and chat groups and parent boards, and is not you, it's somebody else. So,
and it's really helpful information. But it's just that. It's just information. And I tell my own kids, one of them was sicker longer than the other. And he would say, why do I have to do all this stuff? He'd be so frustrated. And I would tell him this very reassuring thing to know, that is, when we get rid of the triggers, your body's going to do it on its own anyway. All of these other things just shorten the path. So if you went into a coma today, your body would figure out how to heal this. Now, once we remove those triggers. So the triggers are, the environmental and the stealth infections. Those combinations, we get rid of those triggers. So if you have a kid in a coma, they're not getting exposed to strep. They're not getting exposed to flu. They're not getting exposed to, tick bites and that kind of thing. So I told my son, if you were in a coma, your body would figure this out. It would just take a lot longer. And so all of these tools that you're hearing, you don't have to institute all of them at once, first of all. And even if you didn't do it perfectly, we are wired to heal. So the child's body will figure it out. Yeah.
Yeah, I really love that.
It really takes the pressure off, doesn't it?
It does. Yeah. And also, I think it's a very, it can be very helpful for a parent's psychology and well-being when you become a learner and observer and in this process, because as you're bringing things to your family or to your team or and learning more, you feel you have a sense of empowerment and you feel like you can actually make a difference, which is really important because the alternative is not so great, where you're just sitting back.
Yeah.
But yeah,
or worse, being told that you don't know that. If you've ever tried like a psych med with your kid and they had a complete mania and it was supposed to be calming, and then the next doctor you see is like, well, we're going to start them on this medication, and you're saying, no, that's not good for my kid. That's not how it worked with my kid. And if you're not believed, go find someone else. Because that's not worth the credibility points between you and your child. Like they know, they experienced it. So if you're like trying to talk, if you get talked into it and then you're trying to talk your kid into it, that's just going to, cost trust points between the two of you. So, just find your team, find your dream team. I talk about that in my book, find your dream team. And that can take a little bit sometimes.
Yeah. Yeah. It's so important to have a voice and, with, have a team that is partnering with you. And, I think also it's, as a parent, you have every right to be that parent.
Parent. Yes. Yes.
Question, be as annoying as you want. There's a lot on the line here, and that's what after going through being a medical parent in a very intense situation with pediatric cancer, I walked away saying, like, I'm not going to leave anything on the table, like any question. Why would I?
Yeah. Right.
And the team, you find people that will answer you and respond to you. And I'm sure it's harder for some people and others, and having that I was a medical provider probably helped. But I think we just need to foster that and help people have the courage and voice to stand up for their children.
Absolutely. Be that patient, even if you're the adult struggling with something. Be that patient.
Exactly.
Yeah.
Oh, yeah. Completely. Completely.
And, for me as the doc, getting those patients has been a blast because they do teach me a lot. They're the ones bringing the book. You need to read this, or you need to know about this. Way back it was mast cell thing, and now everybody's talking about it. It's really nice to know now because it's helping the patients where I was missing it.
Right. Exactly. Yeah. I know, like, that's a perfect example with mast cells. It's like naturopathic doctors have been clued into this histamine mast cell world for a long time. In fact, was a condition we were taught called histodelia. Remember that?
Yeah, exactly. Yeah.
And it was like from orthomolecular medicine. But yeah, like the patients, who brought me Afrin's book that put it all together and helped us understand it. It's like, we learn from you, and that's just a very kind of symbiotic relationship. So,
yeah.
Well, I'd love to get into some sort of basic information. And one of the things I really like about your book is it helped me understand why there's like a classic presentation of PANDAS and PANS, and then there's this other sort of that kind of come from like a chronic pattern over time. It sounds like more similar to like what maybe your children went through, like where there was like a background of other immune issues, and then it sort of tacked on. But I think the common denominator of PANS and PANDAS, maybe we can start with that. And I guess there's another term called PINS, pediatric infectious disorders that it's kind of like there's a lot of different definitions. Maybe we can just start with like what's going on and what's some of the common denominators between all these fancy acronyms.
Yeah, I know. I wonder if we'll ever figure out, which animal are we pots, pans, are we bears?
Right.
Yeah. And I think it's because we're still trying to figure out the mechanism of action and the triggers. That's the classic PANDAS is that a kid was fine, they had strep, and then an overnight sudden change after their strep infection. Well, then there were kids who strep wasn't part of that. So then they had to create this thing called PANS, which has the same presentation, but you couldn't tie it to strep. But yeah, there's this third one that kind of has a more gradual onset that some people have tried to put NADAL, so neuropsychiatric condition associated with Lyme disease. So there's this, we're all trying to figure out, like, are we going to name it by and then there's basal ganglia encephalitis that's being tossed around. Are we going to name it by the trigger, or are we going to name it by the morphological findings? Are we going to name it by the symptoms? And each kind of they have very, very similar but slightly different symptoms. But the thing that is the tie that binds is, again, that immune system was depleted in some way. So the kid who was, quote, fine until this happened, usually in the parents, at least that I'm working with, and everyone's going to see a slightly different patient base by who you attract, but the patients or the parents that I work with, they say, now that we think about it, they were the one that didn't get the perfect attendance record at school. They were the one that kind of sort of had stuff going on, skin rashes or something like that. So they're fine in air quotes, meaning they're limping along and showing up, but not to their best, strength. And then they get something. So it could be an infection, and rarely it could be only the toxin exposure. But the toxin exposure is laid on top of that immune deficiency, and it may actually be the cause for immune deficiency, as in the case of mold. And then, this infection starts. So the most common symptoms, and if we lump them all together, anxiety is a huge one, and separation anxiety is the most common way that anxiety shows up. And that could be to a parent, or that could be to a room, a space, and often is a little bit of both.
Yeah.
So they have trouble, either leaving the parent, or they have trouble leaving home, maybe, school refusal, those sorts of things. Difficult concentration. So it can sort of look like a kid who, if there's anxiety, and they push through, and you can get them to school, and then they can't concentrate when they're there. So they may get first called ADD, but anxiety type, in air quotes again, anxiety type ADD, because they had the anxiety about leaving home and then, couldn't pay attention at school. And what's really curious about all of them is that we really focus on the damage to the brain, but we see urinary frequency as one of the most common symptoms across all of them. Now we see that with mold too. So I'm curious, once we get to do some really deep studies, how many of those kids actually have mold as the core. My top 4 environmental bad guys for causing or contributing to these conditions is weed killer, also known as glyphosate or Roundup. Horrible on the gut. And we can talk about why the gut matters for autoimmune.
Yeah.
And then mold, and then EMFs and mercury. And that just has to do with, all of those have to do with the gut-brain connection, and then their ability to affect the brain and the immune system of the brain. So we can see tics, we can see obsessive compulsive disorder, we can see Kind of a classic one that we'll hear from parents is that they went to school or their handwriting is completely off. Like it looked normal, and then there was something that they might have a drift on the page where they're starting farther over to the right, and the handwriting is just a mess. Or maybe in art, they're not able to do symmetry. So there are these things that some of the fellow PANDAS PANS parents that I'm friends with are school nurses. And I feel like these ladies, not all these, my friends are ladies, but ladies and gentlemen are one of the most important first, exposures or whatever. We need to be educating them because they will be the first ones to see this. Learning difficulties, handwriting, loss of symmetry in art, wow, they could really help identify this and help get kids treated a lot sooner.
Yeah. And what about like the OCD aspect?
So you will see on the clinical criteria, so both of these conditions, PANDAS and PANS, are diagnosed by clinical presentation. So you don't have to have any particular lab that says, yes, for sure, this is what you have, unless you're a lab person. So if you are a proof person, you might be interested in some of the clinical labs, but you don't have to have a positive lab or a lab that's finding something to say, yes, this is PANDAS or this is PANS. When we look at the clinical criteria, the PANDAS starts with tics and OCD to the degree that it's affecting their activities of daily living. So that it's become severe enough that they can't do the things that they should be doing every day. And what's interesting is that's, the category 1 on the clinical criteria of PANDAS, but when you look at the PANDAS parents and they surveyed, so the most common symptoms, I get that from a survey of parents, tics and OCD is sort of like middle of the road. And the first thing that they mention is separation anxiety. So it is there. OCD is definitely there. It's going to look a little different in a kid than it would in an adult, potentially, because the obsessions are the thoughts, the compulsions are the behaviors that follow the obsessive thought. So a child may not be able to tell you, I have an obsessive thought, because they don't have that. They're the only brain they've ever known, so they don't have a way of saying like, this is a really unusual thought. They're just acting through their compulsion to calm the obsession. So that could be to create order in their life. That could be hand washing because their immune system is feeling compromised. So you can see repetitive hand washing, like a classic OCD or germophobia or something like that. But you can also see something that might look like, oh, wow, my kid is finally following directions. They're showering. Wow. And you give yourself a pat on the back as a parent and be like, oh my God, this is amazing. This kid who was just like, Pigpen is all of a sudden showering and cleaning their room and wiping down the toilet and lining up their shoes. And oh my gosh, aren't we doing an amazing job as a parent? And here that was the first flare.
Yeah.
Yeah.
Wow. Yeah. And so you start to see it in a different light when.
Yes. And then it can get more severe with each flare, and then it starts to affect activities of daily living.
So the tics and compulsions and various other things, can you talk about, I think that's important for us to understand because that does unpack some of the way this process is affecting the brain. Like is that coming from a specific region of the brain that is driving that and from some aspect of these infections?
Yes, definitely. That helps it make more sense of why we're seeing some of these particular behaviors. The area of the brain that gets affected is the basal ganglia and the limbic system. And what we see is a damage to the dopamine 1 and 2 receptors and also cholinergic interneurons. So we're going to see changes in how the dopamine receptors absorb dopamine, but also glutamate. And so we can see that the synapses, their brain is swimming in excess dopamine. And that's where we get the adventitious movements. That's where we see tics and movements. And you can actually see in a PANS case, more so than PANDAS, we can see aggression. We can see, or regression. All of a sudden a teenager is talking baby talk. And then I think that the acetylcholine is playing into this, that I don't necessarily exactly understand how, if it's an excess or a deficiency, of what's happening with that. But I know that the plants that I love to use, many of them have activity on normalizing acetylcholine as well. So there is just dopamine, like crazy when they're in a flare. But then what can happen is that in between the flare, they can just hit the skids on the dopamine. And you can see a kid go into depression and ennui, but even worse, despair. And this is where we can get suicidality with these kids. So I think understanding that there's this flare and then, peak trough that can happen with their brain chemistry.
Okay. And how long does it generally take someone to get the right diagnosis? Is it like months, years?
I don't know the latest on this, but I think when I was researching for my book, I think that the average was like 9 doctors before there was an accurate diagnosis. And then, that may or may not have gleaned the appropriate treatment if the doctor didn't have training in that. And that's why, I'm writing the book for parents, and I'm also creating a training course for practitioners so that you get one approach. Because with any burgeoning diagnosis like this, there's no standard of care yet. We're all trying to just figure it out. So I just shared what's working with my patient base. Mm-hmm.
Yeah. And, it seems like that 9th doctor or that 9th evaluation even could have a high degree of uncertainty. And, it's not like, getting like a positive or negative test and it's like, okay, this is reliable, that diagnosis has a degree of it's sort of like an equivocal sort of situation where it's not always lining up. You might even not have a positive test. It's based on symptoms, and you kind of have to just open the door and go through it. I mean, that part seems really scary, and I think it's scary for practitioners even, because you're opening a door, and you're going to be asking a lot of someone. And the patients are being asked to do a lot. And once you go through that door, I mean, it's not something like you just step in and step out. If you're going to heal from this, you kind of have to go through a process, right?
Yeah, walk that threshold. Yeah, I think that there are gradations of severity. And I think that if we can sort of fearlessly walk through that door sooner rather than later, there's a lot less damage that we have to have the brain repair. So being fearful of this diagnosis can actually set it up to being a harder thing to treat in the end.
Great point. I think that's such a valuable point, because I think the impression, like natural medicine or integrative medicine is like, oh, we're going to start with all this, sort of real gentle approach, and if we have to, we're going to have to pick up the notch, But I think it's really important for people to hear that doesn't apply to every condition. Like if you have a formidable opponent,
right, meet it with the same force.
Exactly.
Absolutely.
Yes.
People assume, the same thing with like some of my patients who have Bartonella, like Lyme and Bartonella. And they'll describe themselves as sensitive. And then when I say, well, in your case, I'm just looking it over, I think that, using pharmaceuticals would be helpful for you. And they kind of, it's like deer in the headlights. What, a naturopathic doctor is saying that? And I'm sensitive. I can't do that. Sometimes you're so sensitive because of the mast cells and you can't do plants and that kind of thing. We need to get you out of that crisis point. And it's the same thing with PANDAS and PANS. Like sometimes we're just nailing them with NSAIDs, ibuprofen or naproxen for a good 2 weeks. We protect their gut and do all of the things that we need to do. But, it's also a very good tester. It's also a very good thing of like, well, did that make things go away? Did ibuprofen, a headache medicine, make behavior improve? Okay, now we have information. Now we know a lot more. That was almost diagnostic in itself. So let's proceed forward. We may not do that continuously, obviously, but a short high course is very instructive.
Yeah, and you see some PANS and PANDAS patients, like the first thing they'll do is be referred for like a steroid treatment or IG IgG sometimes, and then obviously like penicillin shots and other things. Can you talk about that? Is that like two different camps, or is there sort of like an integrative camp now where you're doing a little bit of that and then all the other things that you lay out with deflaming and other inflammation treatments and antioxidant treatments and herbal treatments? What are you seeing out there? Do people have to really pick these two camps, or does it all kind of blend together?
Well, I'm hoping what my book and trainings are going to do is make sure that people don't feel like they have to pick a camp, because you have to meet the child where they're at, and every kid and every family situation is different. Every kid, even within the same family, is different, and that's more the rule than the exception. That same with mold. You can have a moldy house, and everyone's going to be sick in a different way. It just is how this world works right now. Because of, it's the filling the cup with toxin world that we live in now. Everybody's got a different soup of toxins that they're working with and infection burdens. So, you're dealing with different soup broth, we might say. So I think it's dangerous to get into encampments, because then I think that we are missing opportunities. So and of course, this is my bias because I practice integrative medicine. I can tell you that the IVIG doctors that I work with and that treated my own kids have said repeatedly as we were going through treatment, your patients are some of the healthiest PANS kids that we work with. So there's something there. And it's not just because it was my kids. I have a bigger, sample set than just my own. I think there are camps, though. I think there are going to be people who read my book and think, oh, that's cute, or that's dangerous, because she's not, going with the standard of care. I think it's just too new and we don't know enough to be really certain of any protocol or camp.
Sure. That makes a lot of sense. And I think in that realm, one of the things that's really great about your approach is that you're thinking about all that needs to be balanced, and there's a certain kind of order and process, because it's sort of overwhelming to do all at once. And maybe we can get into that in a little bit, but I'm just curious, like someone who recently got diagnosed, and let's say their child goes through some initial treatments and they're getting a little stable, and a little bit better, but it's more, I'd say, more stabilizing treatments versus root cause treatments. Like only
steroids.
Yeah.
But not really going farther. Yeah.
Ultimately, like pretty much, I think it's universal. Anybody who's been on the other side of this will say, well, what's causing this? Like, what's going on? Like, we can do all these things, but like, we need to figure out like what caused it. And I think you do a great job of that in the book, of how kind of the flow of that process. I was curious when I was reading the book, as if there's kind of like various clues that push you in certain directions as far as, well, this seems like probably on the hierarchy, this is more of a mold mycotoxin, mold fragment exposure, spore exposure, or this is like Bartonella. Like, is there, because you can't do everything, right? Because there's so many drivers that could be involved. And I'm sure this is experience, but I'm just curious if there's like, as a parent or someone who's thinking about the same questions, if there's a way to kind of say, well, this is maybe where we should start.
Yeah, definitely. I think that there are some keynotes, in homeopathy, we look for those keynotes. And thank you for the great lead in, because it gives me a great idea of like, oh yeah, that one. Oh yeah, that one. So I did do as good of a job, I hope, of putting complete symptom lists in the book. So if parents are like, I don't even know what she's talking about with Bartonella, like what even is that? So that if that is something that, if those symptom lists fit, that helps a parent a lot if you're brand new to this, because the world has been strep dominant in this world. It's all been about the strep. And so that's one thing that, if somebody is just like, okay, well, what we're doing for the strep isn't necessarily working. Is there something else? Those lists are there for people to kind of put the pieces together. But there are some keynotes. So like I was saying, the urinary frequency, in my patient base, that's been almost exclusively mold is in the picture. So they either grew up in a moldy home and they became the moldy building, or they're actively in mold. And I think that whenever there is urinary frequency, there is mold somewhere in their environment, at school or somewhere, at home. Schools are very moldy, so that's why I mention it. When we see rage events, then I think more Bartonella. And you can have mold and Bartonella, so you can have both urinary frequency and rage events. But more aggression and rage, that tends to have a Bartonella flavor to it. When I see tics that have a rotational or spiral, so circular, which might be a child's head has to turn, or it might be their hands turn, like they have to make a circle in the air, or they spin. That is going to be Borrelia. So whether that's either the Lyme disease Borrelia or the tick-borne relapsing fever Borrelia. And the reason is those are spiral-shaped bacteria, and they move through our body by corkscrewing. And the child's tissues will communicate that, and they will need to, quote, release their compulsion or their obsession, which is not an obsession. It's actually a physical feeling that they are feeling in their serous tissues, that they have to move that out, they're communicating that's what's going on. Wow. We can also look at some of the compulsive behavior to kind of understand how can we better support the child. So I talked about the kids who, have a fear of flushing their poop in the toilet. And to me, that is them saying, I can't afford any more microbiome loss. So when we know that, we can do all of the things that we know to support the microbiome, which I talk about in the Regulate Immunity. That I have a core 4 treatment, and Regulate Immunity is one of the core 4s, and that's primarily focused on gut and gut health. And why is that? That's because a lot of these kids have a disruption of their microbiome, which is what allowed the autoimmunity to take hold in the first place. Maybe a kid who has like a strict adherence and a very long, drawn out bedtime routine, and, like major parent attachment and all of these things, that the long, drawn out bedtime routine tells me they don't have enough melatonin and they need some support with that. If there's strict adherence to routines, that tells me their adrenals are burnt out. They just can't handle. The adrenals love routine. So it tells us, a lot of these things really tell us what the child is needing. A vocal tic, that tells me that they have colonization, and they have, basically they're trying to create, when we hum, we create a zone of sterility on our sinuses, our nasal mucosa, not necessarily all the sinuses, but the nasal mucosa and possibly in the tonsils. So when a kid has a hum tic, they've just created a zone of sterility by increasing the nitric oxide on top of the mucosal surfaces. Wow. So then okay, this kid needs some surface gate guarding of the microbes in their nasal mucosa, or maybe in their tonsils. Yeah. So lots of ways to decipher if we're, like you said, I love the word you reinforced in the beginning, curiosity. Stay curious. Yeah.
Interesting. Yeah. It's, and I think, it's important for parents and all of us practitioners to really understand like the biologic underpinnings, the biologic targets of what we're trying to balance or address, because it's like if treatment is being recommended, or you kind of learn something from someone online, or in your own research, to kind of hook that up together as a puzzle with like the biology that it's addressing that's related to this neuroinflammatory condition. And you do a great job of talking about some key things in the book. I was wondering if you could maybe just walk us through those like biologic imbalances that you see. I think there was like 3 or 4 that you really highlight? I'm sure there's a lot more, but those were like 4 big ones that could really help us direct treatment.
So do you mean the monkeys of the mind?
Yeah, the monkeys, the TH17, and I like the monkeys.
Yeah. Yep.
Well, I don't know if I like them, but I like them.
We like monkeys when they're not being naughty. Yeah, right. So yeah, the question is why autoimmune, and the second question is why the brain. So the first question, why autoimmune, has to do with when the body loses the ability to distinguish between self and other, then you can get into an autoimmune disease because the immune system can, and I know you know this, I'm just telling your audience, then your immune system loses discernment, back to discernment again, over what is the tissue itself, and what is the other tissue. The other is pretty easy to understand because there's going to be tags called virus, tags called bacteria, tags called parasite. Mycotoxins are a little trickier because they can go into the cell wall, and it's this phospholipid bilayer, and they can just kind of hang out there. And so that it can be missed by some people. Sometimes you have to have a bigger load of that to identify that that's an invader. So yeah, all of the invaders we would call other. But what determines self is different than what I was taught in medical school. I mean, the gut was everything for sure. But I still had the idea that like our cells are the most important thing driving the bus, which is now we're finding it's probably the microbiome of our gut. So the microbiome of our gut is where, the majority of our immune system is. The majority of our brain chemistry is made. It's where we assimilate nutrients that run the whole system. And we're learning there's a bidirectional crosstalk between the gut and the brain. I left medical school 20 some years ago thinking the brain was the driver. The brain told everybody what to do, and you could induce certain things if you had your patients smell their food before they ate, and eating foods in a certain way. Don't dilute your stomach acid too much by drinking too much with your meal, so that your brain can tell what you're digesting and tells the gut what to do. Well, the gut tells the brain what to do a lot. In studies, there's a really interesting mouse study that I reference in the book where they had lean mice and obese mice, and changing nothing else, not changing diet, movement, anything, light exposure, nothing. They did a fecal microbiota transplant. So they took the microbiome from the lean mice, put it in the obese mice, changed nothing, and the obese mice became lean mice. Wow. Our gut drives a lot. And so what we see is that when the gut is off, we see an increase in TH17. And that's the inflammatory cytokine that's correlated most strongly with developing an autoimmune disease. So we see that, and we see more amyloid plaques, actually, which is very interesting. So this, I think the gut is telling the brain more than maybe the brain is telling the gut. And then the gut is determining how we tag self tissue. So if the gut is a mess, which is why weed killer, mold, EMFs, mercury are on my list, then, and weed killer being the primary one, if the gut's a mess, then we lose the distinction of other. And then if you have that inflammatory cytokine, which that TH17, if we have that in an area, then there's going to be a higher risk of developing autoimmune activity in that area. And what's interesting about why PANDAS and PANS goes to the brain is that intranasal infections of all types, not just strep, induce TH17. And what they're seeing in mouse studies on pandas, so classic pandas, is that the mice have more TH17 in their brain when they introduce strep to the nose of the mouse. So it isn't that strep goes in there and irritates the brain. It's that the strep induces a particular type of cytokine, which then can ride what I call the elevator to the brain through our nose. Because our olfactory bulb, which is our smell nerve, is one of the 4 places in the brain where we don't have a blood-brain barrier. So things can, and the reason for that is so we can smell for safety. It's all about safety. The limbic system, the basal ganglia, that's all about maintaining, are we safe? Where's the food? Yeah. So that area has these bare nerve fibers that reach down so that they can survey, smell, and communicate to the brain what's going on. Well, Th17 can go right up that elevator ride. So too can mycotoxins. So if the child has even a small amount of immune depletion in their nasal mucosa, they're not making good enough snot to break this stuff down and to break down the invader. Snot's full of enzymes and peptides and all these kind of things.
Yeah.
Then that can just get an elevator right up to the brain, right up to the basal ganglia, and in the same region where we see structural changes in the brains of kids with PANDAS and PANS.
Wow.
Did I cover
that? Really
that?
explains a lot. Yeah, it definitely did. It, explains a lot because like if you have, in this population, if you have immune deficiencies, so that leads to inability to clear infections, properly or swiftly or completely. And that leads to more likelihood of autoimmunity, which, and obviously Th17 and then kind of that whole process of like how we got here.
Yeah.
And that it really helps. So I think it's good to know, like when we're thinking about how to help people, it's like, yes, the infections, but how do we balance the aftermath of having Th17 elevation, and should do the treatments, herbs kind of address that?
Right.
And it's really helpful to think of that. And then the fact that this is happening in the brain primarily, like, is another thing to think about. Like, how do we get medicine or treatments into that area?
Yeah.
I wonder if you could like comment on that. Like, there's this whole thing that you mentioned, and it's been mentioned elsewhere. It's like the brain was always thought to be this sort of nothing got across, this like barrier, and now it's seen elsewhere. And you just kind of explained another mechanism that I didn't really know about. But maybe just kind of talk about like, can we treat the brain as well as we think with our therapies and modalities? And
is brain really the target? There's a provoking question, provocative question is like, okay, when we understand that, I didn't even cover the monkeys. The microbiome is our probiotics in our gut. So if we think about the species that live there, they are intricately tied to the microglia in our brain. So we have microbiome is gut, microglia is brain, and the microglia are our resident immune cell in our brain, and they are the munchers, the eaters. And so the reason I call them monkeys is that they can actually like motivate around and move around the brain tissue just like our macrophages can do in our body. They move around and they survey, and our immune system is not only responsible for taking out infections, but also for cleaning things up. There are garbage trucks. So these monkeys are swinging around the brain, just looking for metabolic waste and just cleaning things up. And, basically I think it's when you have a happy microbiome, because they are cousins, they've got like each other on direct text. If you have a happy microbiome, you have like happy monkeys that are just swinging around, eating up the garbage and doing their thing. But when it finds something in an inflammatory environment, and that's where we get the gut-brain connection, that you really get, when I said, are we really treating the brain? We really need to be treating the gut, because that's what can be triggering these monkeys to get upset. And when they get upset, they lose their little arm projections, so they can't move around, and they start spitting out inflammatory cytokines of their own. So a Th17 cytokine gone up the elevator ride from the nose can irritate one of these monkeys, and then it can start to spit out cytokines, which then recruits more mast cells to come. And the mast cells are, I call it like monkey poo. It's an upset monkey. Sit in the tree, complain, squawk, squeak, and fling poo. And that is more inflammatory cytokines. And if they hit another monkey who's just swinging by, that monkey gets upset and loses its projections, gets mad, flings poo. So we have what could have been just sounds like
something that's called a blank show.
Oh yeah, exactly. That's right. Yeah, a fit show. Yeah. Exactly. So this is this little wildfire that can take off in the brain where it would have just been one monkey who's, can digest that Th17, doesn't have to recruit a bunch of mast cells, can be like, I got it, I got it, I got it. But if the microbiome of the gut is messed up, that monkey is very triggerable. It's like more triggerable than a 14-year-old girl, like just like any little thing can set it off. So then you get these monkeys upset, and when the microglia get recruited, meaning they get upset, the only way to calm that down is for that cell to die and be replaced by a fresh one that still has its appendages and isn't flinging poo. So they're upset for the life of that monkey's life. And that means that anything that happens in the gut that upsets the gut, or systemically, meaning you could sprain an ankle, you could lose a tooth, which the tooth is particularly problematic because a lot of times that we will have a crossover of strep exposure when you lose a tooth because of the blood that's induced. So you get a double whammy. Now we have strep, and now you've got two monkeys upset that are recruiting mast cells to the area. And the mast cells are just like a cluster bomb. They just set off this wildfire of inflammation. Yeah. So it's calming that inflammation down and encouraging those monkeys to, go ahead and just die, make room for the next guy, make room for the next
right.
guy.
Because they're supposed to kind of do their work and stop, right? Like it's supposed to be like a cleanup project that kind of has like stops and starts, right? Instead of like an ongoing pruning or ongoing
our
activity.
immune cells are supposed to, they have a very short life cycle in comparison to like a neuron cell. And we look at our brain, 2/3 of our brain is immune. Only 1/3 is for the thinking part, which is amazing. The executive function, the cognition, that kind of thing. So you can tell like pruning and cleaning is a really important part of how our brain functions. Well, it's kind of the same as our gut, which is really interesting. And we have these cells are supposed to just have kind of a short life cycle where they do what they do. So in a normal situation without all the inflammation, that's why Tame the Flame is the first core, because without the inflammation, that mad monkey can go into its programmed cell death, is what it's called. And so yes, every cell is made with a program to die so that it will pre-digest things that are toxic and make them into nutrients so that when it dies, the next cells can use those as food. Interestingly, that's what mold does for us as well in our outer environment. And it's trying to do that in the inner environment, and that's what can be very inflammatory as well. Yeah.
Yeah, and so when it goes through that process of completing that work, then the mast cells don't get as angry.
Yes, the mast cells are just like, they're just doing their program. They're just running their program.
I shouldn't talk about mast cells in such a negative, harsh way, because they're
very
brilliant.
important. Yeah.
Yeah, and it's just that they're just really, really sensitive, and they come to protect us. Sometimes at a high cost to us.
Yeah, because they're non-specific. That's the thing is that I think that's what was very interesting in the studies about treating the mices. Yeah, that'd be right. With their nose with strep repeatedly. The big question was, okay, is it going to be the strep that comes in? Is it, is strep the problem? And finding out that it wasn't the strep, it was what the strep induced. And then, when in my research, finding that every intranasal infection preferentially generates the same cytokine, Th17, which is the one tied to autoimmunity. I'm like, oh my goodness, then it is really anything that can set this off. Once already set off, Yeah.
Yeah, it's just before we leave this particular kind of part of our discussion, I just want to circle back to the gut, because I think one of the things that we see is you ask a question of ourselves or a patient, or the patient might say, well, the gut seems fine. There's no bloating. They're making bowel movements. They don't complain of pain. So I think we can skip over that. Is that a reasonable response in this scenario, or is it always good because we don't always see the symptoms from the gut to tell us that there's a gut problem?
Right. That's a really good point. And we've normalized abnormal also. You know, people are like, do you have normal bowel movements? That's not the question to ask any patient ever. Because they'll say, yep. Then if you say, well, how many times do you go to the bathroom? Well, about every other day. That's not normal. You know, so first of all, we've normalized abnormal, which now if you're listening and you're thinking, well, what is normal? You know, the way we were trained as naturopathic doctors is, 2 to 3 bowel movements a day, fully formed, sinkers, medium brown, no gas, no mucus, no blood, no undigested food. It doesn't fall apart when you flush. It goes down as the whole loaf, the whole thing. Sinkers, not floaters. There is a normal that is healthy normal. And then there's a normal that's abnormal, just normalized, abnormal. So if anyone is not having that version of normal, there's a gut problem.
Yeah. And, I've seen, just to piggyback on that, I've seen other conditions that have like a gut connection, such as skin conditions and various other things where
sinusitis.
You have the patient complaining of no digestive issues. We do the microbiome kind of tests and gut function tests, and it's really off. And you treat it, and everything balances. So I after talking to you, it's just, I think, reinforces that, if there is such a strong gut-brain link to neuroinflammation, that, as you said, it's the, if the primary issue is that the gut's driving it, we should check the gut regardless, if we can.
Yeah.
Or treat it if that's the only option we have in ways that, make sense.
Yeah, there's that precursor thing in children, since this is about pandas and pans. There are sister tissues to the gut that are pretty predictably going to inflame if the gut is inflamed. So you can have no, quote, gut symptoms, but if you have sinusitis, joint pain, or skin problems, or the trio, you've got a gut problem. I talk about in the book the embryonic cell that started your body divides into these families of cells, we can call it. So mesenchymal cells. Then those become different tissues, differentiated into different kind of tissues. Well, the gut and the brain and the sinuses and the joint tissue, those are all part of that embryonic cell. So they're connected at a deep, deep level. So when the gut is inflamed, you can see these particular clusters of symptoms that tell you this is a gut problem. So when we see a kid who then when the parents are like, no, he was perfectly healthy before this happened, I say, was he ever snotty? Have kind of like snoring while he was sleeping, which can be a kid version of sinusitis, skin issues, or ever complain of joint pain. And, beyond played really hard. And, but this would be the kid that, when they were rested watching TV and they get up and they look like an old man. It's like, that's a gut problem. Yeah. Mm-hmm.
Yeah. So I think your book is such a wonderful kind of first step for any patient or family that has this diagnosis. And I remember having a similar book, but from more of a Western medicine perspective for when we were dealing with pediatric cancer. And it just was grounding and sort of like I didn't have to do a bunch of Google searches, and I had a really foundation. I think that's how I see your book is step one, pick up your book, and all the nitty gritty details of treatments are in there, and treatment ideas that are well researched and well thought through. So it's really helpful. I think I want to respect your time, so I think it's best that people just kind of maybe will go out there and pick up the book and read through the treatment specifics. But what I wanted to do is just kind of finish on a note, because you say in the book something that's really important about how to enroll kids in doing things that are hard stuff. Because that's if you have like an NG tube and you can push medicines, it's like a different situation than, asking your 10 or 11, 12-year-olds to do something. And I'm surprised about how many patients and parents will say, oh, they're great at that.
I know. I hear that. I'm stunned. I'm continuously stunned with what I'm perceiving is going to be the big barrier. And they're like, oh, no.
Right. Yeah, that's not a problem.
Yeah.
That's wonderful. But I like what you share in the book about some of this kind of your general philosophy about how to make this all work if you're an overwhelmed parent and you have a child that's not doing well.
Yeah, it's a rule of thumb that I learned from my grandmother, and it's if it's fun, it gets done. And that's just, if you can think of that as the parent, is there any way to make this fun? And if so, do it, because it's more fun for you guys, but, it preserves your relationship, and it does make it something for the kid that isn't a have to, it's a get to. One example of that is making like foam out of the herbal remedy using a foamer and put that on top of the tea or something like that. So it's just like, it doesn't have to be drudgery all the time, and have them participate in it. That's a big thing. And as a parent, for my tip for the families that I work with is make sure that you're having more than one way to administer any kind of medicine, and that you start that from the very beginning so that it's an expectation that they have a choice. Did you want to take your, I put Chinese skull cap in the book. That's one of my favorite botanical avatars for this condition because it hits all the mechanistic marks.
Yeah.
And it's kind of bitter. So, you say, well, did you want to take the Chinese skull cap in a glycerate, or did you want to, take it in the powder that we mix into this or that? Which way did you want to do it today? So the not taking it is not one of the options. The child has agency, they have choice, and they can say, okay, I want to do it this way today. And then you're always setting yourself up for success, because this is a long game. This is a marathon. So you're setting yourself up for success in the very beginning by setting the intention that, first of all, the child has a choice, but the choice is not taking it. The choice is which way did you want to take it? Because there will be the day that they want to say, I just can't today, or I'm not up for it, or whatever, I refuse. You can say, oh, no, that's not the choice. The choice is this one or this one.
Yeah. Yep.
Yeah.
And within that, there's a sense of freedom or empowerment for them. And and I think those are all really great suggestions. So in closing, if you could just leave us with some closing thoughts, and then we'd kind of love to hear more about ways people can follow you and maybe some of the programs you're focusing on right now.
Sure. I guess the last one would be just remember that you do deserve a dream team. You as a parent, you don't have to do this alone. I heard from parent after parent after parent, because the condition has behavior changes, their world got real small. And there's a false belief that can happen with that, is that my world got small, so I can't have support. And I want you to rewrite that belief because you can have a completely supported small world. And that's a really natural thing. When you have a kid who's doing weird behaviors and it's socially awkward and you feel like you want to protect them, and maybe the child is protecting themselves from infection, from germs, and so they don't want to hang out with grandma or grandpa, or they don't want to hang out with even one of the parents. So if you're that parent, go get tested for strep. Treat the strep and the kid wants to hang out with you again. It's magical. But, your world can be small, and it does get small, and that's okay. But then you just build the team that understands that this is a body problem expressing itself as behavior changes. There's nothing broken with your kid. It's that they are sick. Yeah. That's the paradigm change we have to get to with mental health.
Yeah. Yeah. It's a big change, from, people just being, told that and being labeled with this condition that's like a mental health condition, and nobody's digging for more answers.
Yeah. And I mean, there are people with mental health conditions. I don't want to say that, but this is a case where, it's not a child who there's hidden child abuse, or there's, it's not a child who's dealing with this childhood trauma. The trauma is their body is attacking itself. And that can get really scary for people that are around the kid who is having outbursts or, tics or OCD. Like, why is your kid vacuuming again? Or why are they washing their hands over and over again? And, that can, a lot of parents, they just say, it's not worth it for us to go to our friends anymore, because they're not respecting things like, can everybody just wash their hands after you use the bathroom, please? And that's okay. You're going to have some losses, but you're going to also gain a whole group of people if you allow yourself to rewrite that belief that you deserve support, and you can have a changed and slightly smaller group of support, but they can be really stalwart and be there for you.
Excellent. And so I know drcrista.com is sort of the hub of all hubs. There's so much information up there. I love going to your website. Is there any specific programs or things that you're really focusing on these days that you want to let us know about?
Well, I have my book, A Light in the Dark for Pandas and Pans, and then I'm playing around with doing what I'm calling book clubs, which is not where we read all the books on pandas and pans, although there are some really, really great ones. Dr. Nancy O'Hara has one, Demystifying Pandas and Pans. Dr. Bach, Brain Inflamed. There's some really good books. So, that's fantastic. But I heard from parents saying, I'm not even getting time to get through the book, and I'm not even sure what to do. Like the confidence is low, because for some families, this is the first time they've forayed into anything functional in naturopathic medicine, because conventional wasn't working for them. We hear that a lot, right? So we have we're doing it right now, a Pandas Pans Parents Book Club, which is they get part of my membership. They get the membership and all the Q&As that we do with that. But those are more general. Those are more going to be like mold, Lyme, pandas, just all. So it's not going to be as directed. Whereas then the book club, we meet once a week for 11 weeks, where people it's just pandas and pans. It's just the parents. And it's it's a capped group as far as how many people. And it's really beautiful doing that right now. I don't know if I'll do that again. I'm just kind of seeing like how that works and if people really want that support. But that's what I'm working on right now. And then training more doctors. That's my goal.
Yeah. Excellent. Well, this has been amazing. Thank you so much for
your
time and sharing all this wonderful knowledge and inspiration, and sharing just a really loving, caring spirit that you have that makes this, that's what, it's kind of like makes it all come together for me. It's like, if you have all that, it's like, it's more than a trifecta.
Thank you. I love your questions. It's so fun talking, not just colleague to colleague, which, we have that, but like medical parent to medical parent. That's a whole other level of lived it. That your questions are really beautiful, because I think that they're going to help listeners really feel heard and feel like, okay, well, if they had challenges and they're doctors, like it's okay for me to be struggling a bit.
Absolutely. Yeah. Yep. Well, thank you. Thanks for recognizing that. And I'll just keep following your work. It's inspiring us all. And I hope to catch up with you down the road.
Thank you. Thanks.
Thanks. Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from that. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, Much appreciation for you being here with me.